Hi, this is a quick video to highlight the workflow of a physician in HST's eChart. The first thing you'll see when you log in here to HST's eChart is that the system is browser-based, meaning I can access this from anywhere. Simply type in the browser URL or have that bookmarked. When you log in, it'll take you right to the schedule for today's date. You can use your calendar up here to move around to different dates on the schedule if you wanted to. You will also see just your patients in there, so other physicians' patients will be hidden from you. When you do come in here, we're going to talk about two separate workflows. One, what you would be doing prior to the date of service, and then the second one, what you would do to complete that case either on or after the date of service. Okay, let's talk about prior to the date of service. When I come in here and I want to check out my cases for tomorrow, I'll just go ahead and choose tomorrow on my calendar up there, and then go ahead and click on my patient here in the schedule. When I click on that patient, it's going to go ahead and open them up in eChart. It also automatically takes me right to the physician workflow. So there's a lot of areas of the chart, obviously, from pre-op to inter-op to PACU and post-op communications. You don't need to go through all those. You can if you want to, but it will take you right to your physician workflow, and you can start on the patient from there. If the patient has been here before, as in this case, you will see up at the top that patient's picture, and this blue header up here will persist no matter where you are in the chart. You'll always see that date of service, of course, the patient's date of birth, their age and gender. The weight and BMI are going to be encounter specific, so that's going to fill in once they start doing some of that charting on the patient record. You can also come in here to the chart home by clicking on the little menu below the picture and see other information about the current visit. As its information is entered throughout the day, you can also look at a previous visit history in here and see when the patient has been here before. Any previous charts that have been closed will be opened when you click on them in a nice little PDF file for you. It is an indexed PDF, so you can go right to the area you want to go to see that information. So easy to jump around in there on the chart itself. Let's stay in our physician workflow here for our purposes. This is where I would come to prior to the date of service. I'm able to review any documents that are attached to the patient. I would see them right here in a document list. We have an H&P and an EKG here as an example, but of course your list would just include any documents that you typically look at for that individual patient. Simply tap on the hyperlink for the document and it will open up right here for you. So there is my H&P that I can look at. And again, if I want to see that EKG, that is in there as well. And to review that information on the patient, it'll also show you the date that those documents were created, right? Or the date that H&P was performed, for example. If I kind of scroll down my chart here, HST is built tablet first, but you can use it on a laptop as I'm doing today, or a desktop PC, even your phone, and we'll show you that as well. These areas or blocks of information in the chart can be ordered however you want them to be, what makes the most sense for you and your workflow. So typically in here, we have our documents at the top. As you're scrolling down, they'll have your physician orders in here. These are curated by the center. They can be changed at any time, and they automatically come in based on the procedure that we're doing for this particular case. It also shows me any patient allergies here, and lets me know that the medication orders are being checked against a drug and drug allergy interaction for anything counterindicated. To come in here, you have both your non-medication or written orders and your medication orders down here that are typically used on that case. Again, you could have as many or as few as you do. All you do is click on the select all. It'll highlight all the orders for me, and it'll go ahead and sign those. And those orders are now signed for that patient and ready to go when they come in the next day and start going through pre-op and everywhere else in the system. As I keep moving through here, we can get down to on the date of surgery, we would do our H&P attestation. In here, it defaults to exactly what you need it to be, where it's stored in Document Central. That's our central storage for documents in HST. The data was performed, so it's within that time frame. And if there was a paper copy on file, you can denote that as well. But it should default to exactly what you need. You've examined the patient and there are no changes or addenda, and we can go ahead and sign that on the date of service. If there's some changes you need to make, you can go ahead and add them right here. and before you sign it. So you're able to do that as well. The consent will be signed at the center on the date of surgery. It'll pull in exactly how your consent reads, is specific to the center, or it can even be specific to you and your procedure, how you want the consent. It'll also pull in the description of the procedure directly from the schedule. So we have that in there as well. And that's always updated for you. You can change that at any time before you sign the consent as well. Up here at the top, you'll see a little % complete that will show you, if I click on it, the % you have completed of your workflow, and it shows you the areas that have been completed. So you can complete a lot of your workflow before you even get to the surgery center. And it's easy to see all that information here. And I could simply go back to the appointment sheet, go ahead and open the next patient and go through that same process. Okay, I've jumped back to a previous date on my schedule, and I'm going to open a patient that we had completed and show you the process for completing the physician portion of the charting. So I'm going to go ahead and click on Martin here. And again, it will open that patient up right where I need to be for the physician workflow. Again, the documents are at the top here. We can see we're about 85% done this workflow for the patient. And you can see the areas that we've completed in there. It's actually just the op report that we haven't completed yet. But I'm going to come down here and talk about a few other things in the e-chart. So I can see those orders again that we assigned earlier that is doing that med check. If something is counterindicated, we did our H&P attestation prior to that date of service. The consent was signed with the patient at the surgery center with the doctor's electronic signature, the nurse's electronic signature, and the patient can sign right on the tablet. The med rec is completed in here. So this patient was not given any prescriptions on discharge from the center. If they were, they'd be listed out here. The home medications are in here, and those are marked as resume as prescribed. And go ahead and the physician can sign that as well. We signed it the other day at the center. There's an interim op report or immediate op note that can be completed right after the surgery. We see both the pre-op diagnosis and post-op diagnosis in here, the procedure that was performed. There were no findings were as expected, no complications, and the physician is able to sign that as well. You would see if any specimens were taken or implants were implanted in there also from the chart. The op report itself, there's actually a few different ways that we can do the op report in HST. One is you can have a template in here. Again, it's going to bring in most of the information you need to see from the charting in here. So who the physician was, what the operative event was, again, both pre and post-op diagnoses codes, the scheduled and performed procedure, if they were different, you can see that in here as well. The anesthesia type, if we had charted the anesthesia provider, and again, implants or specimens, they would be in here as well. We can have an op report template drop right in here for you automatically, and then you can edit this template as needed. It is just a full text editor here, so any type of editing you can do. We can also utilize drag and dictation. If that was installed here, I would just click my mouse in here, start talking, and it would type exactly what I say. A separate way of doing it, I know some physicians still do the dictation transcription. So if you're using a third party to do that op report, can come right back in here as a signed document if you wanted it to, and I can review it right here. So nobody has to do anything. That's an automatic HL7 interface to bring in the medical document management piece. And I can click on that to view it right here and go ahead and sign off on that op report. When I'm done, I can just go ahead and click sign, and I've completed that. You can see that my workflow now jumps to 100% complete, and I'm good to go. There is a task list in the system that will show you all the areas that you need to do that you can go look at as well when you're in here. But if we make it as easy as possible for these physicians to stay in their area, and anything that you need to see should be in your workflow. If it's not, the center can simply set it up so that it is in there. All right, so admittedly, that was a quick overview for what the physician has to do, but it's only a few screens in the system and everything should be there for you. If you have any questions, again, please reach out to your surgery center leadership and they'd be happy to go over it with you. As a quick note, I did mention that everything you see in here is available via tablet, via laptop, even via phone, and I have a little rendition of my phone screen I can see on here, and all that information is in there. It is possible to access this from virtually anywhere you have access to the internet. Thank you very much, and we look forward to working with you.